To me, this is one of the biggest crises and issues that we have had.
Chronic absenteeism, a crisis in our schools across the country.
If they miss over 17 days, then they're chronically absent.
State leaders noticed this trend after the COVID-19 pandemic.
Bringing them back to the traditional brick and mortar has taken some time.
It's an issue in urban, rural, and suburban school districts, but it's impacting one group the most.
So the poorer the county that they're coming from, the higher their chronic absenteeism rates.
So what's it going to take to fix it?
It takes a village to reinstill that belief of the importance of showing up to school.
We ask the experts in Local 12's Crisis in the Classroom Town Hall Chronic Absenteeism.
Ohio is on the cutting edge of trying to figure out why chronic absenteeism is occurring, but most importantly, how to reverse, reduce, or eradicate it.
From Local 12 News, Crisis in the Classroom Town Hall Chronic Absenteeism.
Thank you for joining us for Local 12's Crisis in the Classroom Town Hall on chronic absenteeism. I'm Chelsea Sick. Chronic absenteeism is a nationwide problem and one that became most noticeable after the COVID-19 pandemic. The U.S. Department of Education reports more than 14 million students nationwide were chronically absent in the 2021-2022 school year. We looked into the most recent numbers in Ohio, Kentucky, and Indiana. In Ohio, 25.6% of students were chronically absent in the 2023-24 school year. That's 1 in 4 students. It's declined from 26.8% in the 2022-2023 school year. In Kentucky, 28% of students were chronically absent during the 23-24 school year. That's 1 in 3 students. In Indiana, 17.8% of students were chronically absent during the 23-24 school year. That's more than 205,000 students. According to the U.S. Department of Education, chronic absenteeism is typically defined as missing at least 10% of school days, or about 18 days in a school year. That can be for any reason, excused or unexcused. We have invited a panel of experts to be a part of this town hall. Florence Chang from the Kentucky Department of Education, Susan Bodery and Gina Wilson from the Ohio's Stay in the Game Attendance Network, Anthony James, Miami University Interim Department Chair for the Department of Family Science and Social Work, Deborah Hauser, Superintendent of Middletown City Schools, and Manisha House, the Director of Positive School Culture at Cincinnati Public Schools. We want to start by looking at Cincinnati Public's chronic absenteeism rates. The Ohio School Report Card shows 43.5% of Cincinnati Public students are chronically absent. Almost half of the district schools have an absenteeism rate at 50% or more. 6 of their schools have more than 70% of their students chronically absent. You can see a list of those on your screen. Manisha House with Cincinnati Public Schools answers this town hall's first question.
What are different reasons why students experience chronic absenteeism or don't come to school?
So I try to simply break that down to say there's 171 school days for students in Cincinnati Public Schools. If they miss over 17 days, then they're chronically absent. And we could break that down further by saying 2 days a month. And if you think 2 days a month, that's not a lot. So it can occur if students are sick, if students have reoccurring doctor's appointments or therapist appointments, if students don't feel safe or welcomed, or if they might feel embarrassed about where they are or where they're performing academically, so they shy away. There are some barriers that occur. For example, there are a lot of students that walk to school, and we do notice on inclement weather days, especially if it's raining or storming, a lot of students don't attend or they attend late. And so a lot of times we think of chronic absenteeism as student missing the whole day, but the state, we calculate absenteeism in hours. So each time a student is late, each time they leave early, that adds up towards chronic absenteeism. And it also includes those students if they're suspended or expelled for behavioral challenges. That also counts towards chronic absenteeism as well. So we really have to work on how to support students so that they're behaviorally appropriate in school, so that it doesn't lead up to them exclusionary consequences for them that keep them out of school, but then also how to make school rewarding for them so that they come and then to extend resources and partner with community resources to eliminate or reduce the barriers that keep them from coming to school.
Middletown Schools, another local school district battling chronic absenteeism rates. According to Ohio's 2023-24 state report card, the Middletown High School had 55% of its students chronically absent. At Rosa Parks Elementary, the rate was at 53.2%. What I thought was interesting in looking at your numbers was this, you are even having some trouble with the younger kids, and at Rosa Parks Elementary, you're more than 50% chronic absenteeism rate. Talk about the challenges with those younger kids and getting them to school.
So the younger kids, I mean, really all of our students face the same barriers, K through 12. Some of the things that we find, one of the things I would say, it falls under what we call family barriers. So that would be if they miss the bus, they don't have a ride to school. Family, they need daycare. Family needs daycare. A student has to stay home and take care of the younger children. So, I mean, those barriers and those instances, really, they span from K to 12. So the elementary, it could be they don't have clean clothes for the day. So family barriers, when we surveyed our population, that's what came back as #1, and that could be a slew of different things.
Kind of fill me in on where you all are right now, as far as I know you've been really working to get those numbers down.
Yeah, so chronic absenteeism has been one of our district goals since the beginning of the school year. Really, we rolled out the goal and the initiatives last January. So we have close to, going on a year of chronic absenteeism focus. And since the beginning of the school year, it's really looking at the data, talking to our families, looking at the barriers that prevent children to come to school. We've entered into an initiative with Stay in the Game and FC Cincinnati. So the partnership, working with them and the different initiatives that we've partnered together that really focus in on chronic absenteeism. But one of the biggest, I should say, ahas is collecting the data and looking at the data. You know, we do that monthly, we do it quarterly, and we're getting ready to do it for the semester. And what we have seen with the different initiatives that we kicked off at the beginning of this school year, I mean, we have seen considerable decrease in chronic absenteeism. And the big piece also to recognize is it's not just students, you know, showing up to work or just showing up in general. Since we've come out of COVID, that just doesn't seem to be as important as it used to be.
There's a difference between chronically absent and truant. Coming up, we talked to Ohio and Kentucky school leaders about the difference. Plus, you heard Superintendent Hauser mention Ohio's Stay in the Game attendance network, how its expansion to Cincinnati and the partnership with FC Cincinnati is making a difference as our local school districts combat chronic absenteeism. Stay in the Game Attendance Network is a statewide initiative hoping to combat chronic absenteeism here in Ohio. It was launched in 2019 and partners with pro sports teams to encourage students to go to school. Here in Cincinnati, they partner with FC Cincinnati. Stay in the Game's Susan Bouldery and Gina Wilson explain how the network is addressing the issue.
Well, the Stay in the Game network was started actually in 2019. We had a chronic absenteeism issue in Ohio prior to the pandemic, which exploded during the pandemic. And the Cleveland Browns Foundation, Proving Ground at Harvard, and the Ohio Department of Education and Workforce are the founding partners. And Battelle, the scientific and research organization that's in Columbus, joined them in 2024. And then we also had the Columbus Crew and FC Cincinnati join the network to make sure that we've got really good professional team coverage across the state. The goal of the network is to connect, convene, and really lift chronic absenteeism up as a movement to help people understand why it's so important to be in school every day. A lot of parents don't understand that it has a direct track to reading in the 3rd grade. And so if you're attending school regularly, you're 3.7 times more likely to read by the end of 3rd grade, and you're 9 times more likely to graduate high school. So it's a very important thing.
Is this a crisis? Is this one of the main issues that districts are dealing with?
I've been in the education and education policy space for 25 years. To me, this is one of the biggest crises and issues that we have had.
A wonderful part of my job is connecting with districts at least on a monthly basis, sometimes more, to really look at the data when it comes to chronic absenteeism in their district and find trends and ways that we can help combat chronic absenteeism by implementing interventions and supports, understanding what it means to progress monitor those interventions, and really communicate with stakeholders such as students, families, and community organizations to help support and bring that awareness to chronic absenteeism.
And if you all don't mind going into just a little bit more detail about what those organizations like FC Cincinnati or others here in Cincinnati are really doing to encourage these kids to get to school.
FC Cincinnati is the newest addition, so we're really excited to have them. They're doing things like running contests for schools based on how many days students are coming to school and giving them opportunities after school. They're doing clap-ins with mascots to celebrate the fact that students are there. They're doing all kinds of online activities with and for them, giving away tickets, making it an exciting environment.
I am so excited about our new partnership with Stay in the Game Network. They have been a wonderful resource. They have provided us with a network with other districts across the state. We're able to collaborate about specific issues. For example, we might say, what do you do on rainy days? We know that students don't attend on rainy days. What strategies do you have? Do you have a walking school bus? Do you pass out ponchos? Do you think about what's being served for lunch? We know in our high schools, a lot of time our most attended days are Wednesday, Chicken Wing Wednesday days. You know, students, sometimes we think about what are those things that influences kids to come. So that Stay in the Game Network really provides us with resources and helps support us with data and analyzation and just tools in our toolkit and resources with attendance works and even incentives with their partnership with FC Cincinnati or Cleveland Browns so that we can be able to incentivize students that are improving their attendance or reducing chronic absenteeism.
There's a difference between truant and chronically absent. In Ohio and Kentucky, students are considered truant only if they have a certain number of unexcused absences. I asked school leaders to explain the difference.
Well, chronic absenteeism is that students miss 10% of their instructional hours for any reason. So it could be unexcused, it could be excused, it could be they were sick, it could be they went on a trip. It's any reason whatsoever. Truancy's outlined from the legal system. I mean, we work under specific guidelines that says if you have this many unexcused absences, conference is required. If it continues, you could wind up in court. But we live under guidelines when it comes to truancy.
Truancy is a more strict definition. So to be truant means you have to have at least 3 unexcused absences. And then by law, you become a habitual truant at 6 unexcused absences. Now, we do have a new House bill that is now in effect this year related to informing the county attorney when students have missed 15 unexcused absences. And so that's starting K through 12, which is really hitting a lot of families now, realizing as they're getting those letters, like your students missed 15 unexcused absences. And so that's in the truancy realm, not in the chronic absenteeism realm, but they are highly related.
Because a student can be truant and still be falling under that chronic absenteeism, correct?
Correct.
On my social media, I asked, what questions do you have for state and local leaders about chronic absenteeism in our school districts? Eileen Krause asked, I would like to know how many are absent because of medical, a disability, and how many are because parents or the students don't care. Are you able to kind of put that into perspective for us?
Sure. So there are a myriad of reasons of why students are absent, and you touched on a couple right there. Mental health, anxiety, disengagement, a lack of connection with school. Those are all reasons why kids are absent. What the specific numbers are will depend on the local community. So whether it's a medical reason or a physical medical reason or something related to mental health, those are going to vary by district, including things like transportation challenges, educator shortages. Those are all contributing to reasons why kids may not be in school.
Ohio also has a state law that could be bringing chronic absenteeism numbers down. Coming up, we talk with the man behind a study that found positive behavioral interventions encourages kids to come to school. In 2018, Ohio legislature passed House Bill 318, the Supporting Alternatives for Fair Education or SAFE Act. At the time, the Ohio Department of Education called it one of the strongest state laws in the country addressing multi-tiered behavioral supports to reduce disciplinary referrals. Miami University's family science and social work professor Anthony James conducted a study on the impact positive behavioral interventions and support, or PBIS, had on chronic absenteeism.
What did you find?
We found several things. It was a 5-year grant. One of the main findings was that the schools who had implemented PBIS, or positive behaviors, interventions, and supports, which is a multi-tiered system of support, that those schools had lower chronic absenteeism rates, about 5% lower relative to schools who had not implemented positive behaviors, interventions, and supports, or PBIS.
Talk about that correlation with the positive behavior and chronic absenteeism. Why is that encouraging to kids to get them to come to school?
Yeah, so chronic absenteeism, of course, is a complex issue, and although people may desire to reduce it down to one or two things, it's really a multifactorial problem. So you want to look at things like early intervention. You want to look at how schools are creating a positive climate for their students. You want to look at the relationship between schools, families, and communities. You have to have data-driven approaches. So there's a variety of things that need to happen to reduce chronic absenteeism, and that's exactly what PBIS does. And so if we look at what Ohio has done as a state, is to mandate a multi-tier system of support like PBIS, it makes sense that those schools that focused on things like early intervention, rewarding positive behavior, creating positive school climates, engaging families and communities, it makes sense why they would have lower chronic absenteeism relative to the schools who did not implement PBIS.
Ohio has pledged to cut its chronic absenteeism rate by 50% in the next 5 years. Is it possible? We ask our panel members. Plus, is this an issue because parents just don't care? Experts weigh in on the community's biggest question. So what can be done to solve the problem of chronic absenteeism? In October, state leaders pledged a commitment to cut chronic absenteeism. Those leaders pledged to cut it by 50% over 5 years in Ohio schools. Do you all think that is possible, and how are they going to do that?
I think it's absolutely necessary. I do think they can do that. I think we can all do that, and we all have a role to play in it. We know that through the data that what it's going to take is taking that rate down, the chronic absenteeism rate down by 2.6% each year. We can do that together. Stay in the Game Attendance Network is the level 1 solution for the state. We invite other districts to join us. We invite other foundations and companies and community members and civic leaders to join in the effort, because we all can send encouraging messages to the students we know. So we encourage you to go to the Stay in the Game website at stayinthegame.org and sign the attendance pledge. Start thinking about what is it that you can do to encourage the students you know to be there every day, and what can students do to encourage each other.
In your research, did you walk away from that experience optimistic that this would continue to help chronic absenteeism here in Ohio?
Yes, absolutely. Ohio is on the cutting edge of trying to figure out why chronic absenteeism is occurring, but most importantly, how to reverse, reduce, or eradicate it. And so they're a part of a group of states that have looked at 5 years and reducing chronic absenteeism by 50%. I believe the state of Nevada is another state that is also implementing initiatives. And so that's ambitious, it's bold, but those are the types of initiatives we need to really look at complex issues like this. And I'm confident that if schools can continue to provide the resources that school districts need, that families need, teachers need, communities need, that they can certainly reduce the chronic absenteeism rates.
When I asked what questions do you have for state and local leaders about chronic absenteeism in our school districts, many people asked about the parents. Charlie asked, is this due to the parents not caring? Those numbers are staggering. Nancy said, until parents take responsibility for their children, absenteeism will remain high. What is your perspective on parents and the impact that they have on chronic absenteeism?
Well, parents definitely play a part, but like I said before, this is a societal issue now. Of when it comes to people showing up when they go to church. Do you keep your doctor's appointment? Parents do have a lot to do with their child getting up and going to school, but that's not the sole reason.
We need our parents. We need our parents engaged at the levels that they can be engaged with, whether that's making sure their students are at school or that they've completed their homework, or if they have concerns, they can make a phone call or send us an email, or connect with partners within the community to help support or be a voice or an advocate with them. It's really a whole community effort. And so we really welcome the community within our schools, and we really value their input and their insight, not just for their child, but for how we operate schools.
What more needs to be done on the federal, state, or local level to really address this issue?
I think as well as if we can continue to align resources and even fiscal resources in specific areas and neighborhoods that really need targeted assistance. I think continuous partnerships with other districts. I think as the community can continue to get involved, to recognize when students are not attending, or even motivating students when every opportunity that they have, celebrating students. I think bringing back the attention and focus on education, the focus on the impact that education has on our community and on our society is of great importance and will really help us overall.
Thank you to our panel members for participating in Local 12's Crisis in the Classroom Town Hall on chronic absenteeism. And thank you for joining us. I'm Chelsea Sick. You can continue this conversation or share the town hall with your friends by going to the Local 12 YouTube page. You can also find it on local12.com. Just click on this story on our homepage. Happy holidays and good night.